Bruce Winning.
Nice. So, I believe you're in here for a physical for your job, that's what I was told. Any particular reason you're interested in exercising more? Any?
You know, my doctor just said I should be exercising more, stay fit and active and healthy,
Okay,
keep my insurance rates down.
Nice, nice. So you get started with that, at the right place for that. We'll start off with pre-assessment screening. Just a sheet for you to fill out, just having consent and for you to expose your medical records, just a contract to form, just willing to exercise and participate in the programs, just so you recognize, so it's recognized. So if you could sign and date this for me, then we can begin. I'll go over the explanation of the procedures, so we could test you to make sure you're physically safe for the exercises, and we'll get you on the right path for lifelong. So procedures we'll work on when we're checking on your body composition. We'll do that by doing a skin fold assessment. Have you ever heard of a skin fold assessment?
Yes, I've heard of skin fold assessment.
Okay, so if you're familiar, skin folds are with calipers.
Caliper? The pincher?
Right, yeah, you use it to pinch the skin. For example, one spot's the tricep, and when you'll be standing, it'll be the back of your tricep. You use caliper to pinch, and we'll get the reading, and that'll be your percent body fat that
Okay.
So we'll get your percent body fat for your body to count, and then next test will be cardio test. For that, I'll have you ride a stationary bike for 6 to 12 minutes. You'll have your heart rate monitored, so we'll check how that's progressing throughout the cycling. So if it gets really high, we know it's just unhealthy, and we want you at the right intensity level to make sure it's appropriate for you. Next test, we have flexibility test, real basic, sit and reach test. I'm sure you've done it throughout your years.
I participate in yoga sometimes.
It's good, it's very healthy, good lifestyle. We'll just test the hamstrings for flexibility there. Then the last test will be a muscular fitness test. So for this we use dynamometer. It's for testing your grip strength. We do a couple trials for grip strength, and we'll read the meter, and that will determine your strength. Any questions? Feel free to ask any questions anytime.
Does it matter which hand I use?
I prefer to use your dominant hand and whatever right leg, whatever you've been used to. Okay. So next, for the exercises, we have a questionnaire to ask. In this questionnaire, I ask several questions, asking about related to your cardiovascular system, history, current lifestyle choices, and see if you have any risk factors. So risk factors, the number of risk factors determine the intensity and level you should be working at.
Okay.
So for the first risk factor, have you ever had a family history of illnesses of heart disease, any heart attacks, any early deaths in the family?
My parents died at an early age, they did.
Parents passed away. Any related to heart disease? Any?
No, they were murdered.
Murdered. Okay. Sorry. Are your parents cigarette smoker?
No, I don't participate in any of that. It's not healthy.
Right, yeah. No benefits from that. Regularly sedentary lifestyle, are you active? Do you run, lift weights?
I'm usually on my feet for my job, walking around, checking out my employees and whatnot.
True. Gotcha. Good, good. Do you have high blood pressure? Or you know your blood pressures?
I just have some high blood pressure, dealing with the job, crunching numbers and all that,
I understand.
9 to 5, all that in the cubicle, you know how it is, I'm sure.
Definitely. High blood pressure. Okay. So that would count as one risk factor. Do you worry your cholesterol level? Do you have high cholesterol?
I've had regular doctor appointments that said it hasn't been bad, so.
Okay, good. And do you aware if you have diabetes or not? Have you ever been tested?
I don't have diabetes.
No
I don't have
diabetes.
much of a sweet tooth myself.
Good. Okay. And then, so we have one risk factor, high blood pressure, not a problem. That'll put you at low risk, but do you have any major signs of like dizziness, shortness of breath, any aches or pains, getting up quickly, dizzy?
Oh yeah, like my chest sometimes gets a little achy, and if I stand up, almost every time I feel a little lightheaded and dizziness.
Yeah, lightheaded, okay. It's lightheaded when you stand up? Correct?
Yes,
Okay.
it's been that way for a couple of years now.
A couple of years. Okay, so yeah, that will put you in a high risk classification.
Okay,
So since you're at a high risk, shortness of breath, that's just cardio, symptom of cardiovascular disease in the future currently. So we can't do any testing today because we'll need your doctor's approval since you're at a high risk. So next time you come in, we'll be in contact with your doctor, in contact with you. So hopefully next time we come in, our paperwork's filled, everything's transferred, and we'll get going. Hopefully you're off to a good, healthy life. Any question, anything I can do for you?
no, I think you've answered all my questions, doctor, and hopefully my doctor gets back to you with some good news.
Sure, sounds good. Thank you, Bruce.
Have a good day.
You too.